Okay, I think we'll get going. I just hit the record button. So welcome everybody. This is Heather Riggs with the New England Museum Association. I want to welcome you guys all on a very June summer-like day out there. I hope you guys are staying in a nice, cool place today. So today we're going to get going. I want to actually thank Betsy Loring. So I'm going to turn most of this over to her because this is something that she has been wanting the NEMA staff to do for quite a while. So Betsy produced it for us, which we are very thankful for. That also reminds me that if you guys ever have any ideas that you want to explain, discuss during like a town hall or a webinar, definitely get in touch with the NEMA staff. We are open to everything and anything. And we want to continue conversations that are happening out there. I know there's a lot of questions still as some of us are starting to reopen and everything. I will let you guys all know that today's session is being recorded and will be available on the NEMA website later on this afternoon. So if you have to sign off a little early, want to revisit, or want to share it with your colleagues, feel free to do that. Also, the chat feature is available if you guys have any questions to ask Dr. Erin Bromwich. During this, we also have the option to actually give you voice. It's always nice to hear everybody's voice instead of hearing them type. So there's that option there. Just to let you guys all know, you guys are all muted right now. So you would have to unmute yourself if you would like to speak. So Betsy, I'm going to push it over to you now.
Well, I want to correct you on one thing. I wasn't pushing NEMA to do this. I've been trying to push everybody. Some of the national, yeah. I've been pushing everybody. But I had hoped one of the national organizations would do this, and I found that people were more interested in doing peer-to-peer kinds of stuff. And that makes me nervous as somebody with a science background, that we don't get enough context, industry-specific context on things. So I wanted to introduce Erin, and you'll have to correct my pronunciation, but, and I'm going to try not to go super fangirl on you. I'm a fan of epidemiology. And so I heard about, I've certainly seen Erin Bromwich's articles about COVID, and I've been sharing them everywhere possible to the annoyance of many people. Because they place context on things and they're really good risk communication. And then I heard that Erin had had the kindness to do a webinar like this for Boston theater folks, and that was shared. That information was shared in a NEMA education roundtable. So he opened himself up as a target. Sorry. So with that, I will do this introduction. Erin Bromwich, PhD, is an associate professor in biology at UMass Dartmouth. He graduated from the School of Veterinary and Biomedical Sciences at James Cook University in Australia, which you will realize as soon as he speaks, where his research is focused on epidemiology of and immunity to infectious diseases in animals. His research focuses on the evolution of the immune system and immunological mechanisms responsible for protection from infectious disease. Dr. Bromwich joined the faculty of UMass Dartmouth in 2007, where he teaches courses on immunology and infectious disease, including a course just this spring on the ecology of infectious disease, in which he was able to focus on the emerging SARS-CoV-2 outbreak in China and now here. He's also an on-air CNN contributor and writes regularly for CNN.com. And so, Erin, welcome. Thank you very much. And the way I was hoping we could structure this was to have you put a little bit of context on, we have a lot of exhibit people who are being asked to clean absolutely everything. And just sort of wanted you to place a little context around the emerging data, and then we can get into more industry specific quirky questions that we have. So take it away. And thank you.
Thank you for that introduction, Betsy. It is great to be here. It's something that I have really been trying to do in general, that especially local, but when we're dealing with 80 people and in New England, that all becomes local. I just try to carve out the time to make sure that I can do this, because I find that your kids are in my classroom. And especially with local people, I find that they're the ones that are sponsoring the soccer teams and just being a big part of our local community. And it's sort of my time to be able to give back. A little bit about me and my work. So I deal with infectious diseases of animals, and I focus on infectious diseases of animals that jump from animals and infect humans. So I work on zoonotics and reverse zoonotics, ones that go from humans back to animals. We do it the other way as well. So they're a little bit more effective than us, but they jump both ways. So for the last 20 years or so, I have been working with fun pathogens that would really like to use me as a food source, and my team of people that work with me, which is usually up to 20 people, and trying to keep them safe. And that's from everything with working with live animals through to working in the lab. So we work with a whole bunch of different scenarios where we need to understand risks and put in place protocols so that people don't get infected and don't get sick, and I don't end up in the news for doing something wrong. It just so happened that with this particular outbreak, the class that I teach every spring, we deal with an emerging infectious disease, and I teach the students from a point of view of understanding the host, understanding the pathogen, and understanding the environment. And it's when those three things interact, and there's some things that we'll talk about today, especially with the environment. When we modify the environment, we either bring hosts closer together, which allows the pathogen to jump faster, or we adjust temperature or humidity, which allows the pathogen to either be killed faster or survive longer. All of these things together, so the host, pathogen, environment, make a really interesting triad in order to understand how pathogens move through populations. And it just so happened that in December I saw this coming. By January 6th, I put it into our curriculum. And so then for every week from July 15th onwards, my students and I were following this emerging pathogen coming out of China. We knew by February that it was going global. And then early March, we knew what was really going to happen, because I actually was flying to Australia. Just before I flew to Australia, before our spring break, I said to my students that I will not see them again, because when I come back, we'll all be closed down. They laughed at me, said I was overreacting. And I'm like, anyway, we'll see. So 2 weeks later, I came back and Massachusetts was locked down and schools were over. And that was the end of that. A big part of what I've been doing all the way through this is when you're dealing with an emerging infectious disease, there is no experts. There literally is no experts in this field, because nobody had seen this pathogen before. And therefore, what was happening, and I'm sure you've all seen this, is it felt like the information was like a tennis game. One day it was here, the next day it was here, and the next day it was here. And it was really hard to work out what was correct and where I should be investing my energy in regards to protecting ourselves and our families, our workplaces. So what I started doing was writing these little pieces that I was sending out to friends and family, just using my spin with infectious disease and working with animals and working with humans, and saying, this is what we know, this is what it means, this is what you should do. And so one of my first posts was go out and buy toilet paper, go get your prescription medications. That was in February. I was laughed at a lot, and people were asking me if it was real. And I'm like, yes, because when supply chains break down, I don't want you guys to be part of the problem. And if I'm incorrect, just use it to go camping. Just use the canned food, the water, the things that you buy that way. And so I just kept writing, and I always wrote these things towards my family and my friends, because that was my audience. I needed it for myself, but I was applying it or writing it in a way that was directed towards them. And so some of the things that have emerged, and the thing that really resonated, I think, across the US was one of the posts I wrote about the risks. And I was finding that a lot of people were wasting a lot of mental energy on things that they were a chance of infection, but they weren't really the major cause of infection. And so when I put that together, I was trying to just craft a story so that people understood where they should tune their attention and adjust their life accordingly. So what we know now, since I wrote that post, essentially everything has held true, which is that anytime we put people in an indoor space for an extended period of time, the risk goes up. And so we have a tier of risk. The most risky is an indoor conversation with a person within 6 feet. Basically, when you're talking, the droplets that are coming out of your mouth will travel. Some will fall at about 3 feet. Others will travel to about 6 feet. But those little droplets will contain somewhere in the vicinity of 1 virus particle up to tens of thousands of virus particles. And that only needs to land in your eye, be breathed in through your nose, or breathed in through your lungs, and that can be enough to establish infection. So when you look at contact tracing, so when they talk about risky and someone being infected and who do they contact, if you've had a conversation with a person for longer than 15 minutes in an entire week, so not just a 15-minute conversation, but a 5-minute conversation today, a 5-minute conversation on Wednesday, and another one on Saturday, that is enough to get to that 15-minute limit that is required, that gets you into that high-risk category for infection. So we know those face-to-face conversations are risky from an infection standpoint. Wearing a mask will drop that down, will make it about 50% safer at the worst. A better mask will improve the safety even higher. And then if you get into a conversation where it needs to be extended, then a face shield and mask will actually work even better. If you go into grocery stores, you'll see the plexiglass up there. The plexiglass is to stop those droplets traveling directly from the customer to the customer service person, providing a protection for them. That's why you can get 2 feet away at a checkout, is that plexiglass will stop it. In the absence of having that, you need to have a face shield on the person. Again, one of the things that you're going to face in your businesses is face mask compliance. One of the ones that I've been worried about in some of the businesses I'm working with is when people won't comply, they turn into the most dangerous person that you can have, which is a person that's yelling and shouting, and they're projecting droplets out at you. In those particular circumstances, you must have a face shield on or glasses on to protect you from those as much as you can. So that's the highest risk one. It is lower when you're outdoors, but still a 3-foot conversation face-to-face with somebody is one of those high risk. It doesn't matter indoors, outdoors, you will be contact traced and infections can establish that way. But those type of transmissions are the one where I am sick and I infect Betsy. And then Betsy gets sick and she infects, I'm looking, Meg. And it just goes 1 to 1 to 1 because it's those personal interactions. The ones that we're more worried about are where I am or somebody that is infected comes into our environment and is in there for an extended period and is breathing lots of droplets into the air, those respiratory droplets into the air. We know when that happens that just in a single room, you can take down 90 people. We've seen in churches that one infected person coming into a church has resulted in 4,800 people being infected. So it all started from that one index case and just radiated out amongst the people around them, who then spread it to the people beyond them. And then next time they came together and just started these huge clusters. So when we're looking at museums, when we're looking at indoor spaces that we're managing, we really do need to think about capacity, and we really need to think about what our control systems for HVAC look like inside those spaces. The more modern the building, the luckier you are. They will have better filtration, a better HVAC system. They'll have better makeup air coming in. The older your building, the typically more concerning it will be. It may be window units or split units if you're using air conditioning, and those things are not great because they provide no filtration and they provide no air from the outside. So you've got to look at and understand your environment. I really do encourage anyone that is in charge of a facility to either get an engineering inspection of your HVAC system or talk to the building owner to get that, to really understand what you are being presented with in regards to risk and how many people you can have inside. As an example, I was working with a state courthouse. The building was very, very old, and the systems, while they had ducted air conditioning, they didn't have good filtration or good makeup air coming in. So they've had to retrofit what they're doing because they're literally putting hundreds of people in a building close together. Whereas I was with another federal courthouse, the building was less than 5 years old. They had essentially hospital grade air conditioning in there. And so they could bring more people together in an indoor environment more safely. So really work with those people. What you want to be able to do in the best situation is, if you're working with a central air conditioning system, get the highest rated filter that your system can handle and still push enough air. You're trying to get it up to, it's called MERV, M-E-R-V 13. But you'll find if you just jump to MERV 13 and you've got an old system, you'll actually decrease airflow because it's trying to push the air through the filter, and you'll actually do yourself a disservice. So you want to work with the filter that is the highest rated you can, but still get good airflow. You then want to work with what's called makeup air. Most new systems will bring in air from the outside. It's a requirement of new buildings. Bring air from the outside, it'll condition it, and it'll be changed maybe 10, 15, 20% of the air every hour in the building is changed through that system. What you want to do with that is bump that as high as you possibly can while still maintaining adequate environmental conditions for your workplace. Many of you have things that you're trying to protect anyway, so I know you need to keep your humidity very regulated. But the more makeup air you can bring in or crack a window open, the better you will be in regards to an infection standpoint. We know from schools, if you open a window in a classroom, you reduce the incidence of influenza by about 50%. So open windows is a good thing in order to get that air exchange. One of the interesting ones that is coming out now in regards to understanding how the virus behaves in an indoor environment and outdoor, but we're more worried about indoor, is the effect of humidity. Humidity is really important for the survival of this virus. If you have it below 40%, the virus, the respiratory droplets, the water around the virus will evaporate. It'll keep it up in the air for longer and helps it persist for longer in the air and on surfaces. Above 60%, the droplet that comes out of people when they're breathing grabs more water and it drops it down onto surfaces, so it takes it out of the air, but now it puts it on surfaces that you have in your workplace, and now they become a higher risk for infection. Again, the virus persists longer being contained in that droplet. The Goldilocks zone for us being indoors is 40 to 60% humidity. Getting it up around 50 to 55 is essentially where you want to be if you can, based on what you're able to do with your environmental controls. That makes the droplets dry out, it makes them fall out, and it actually makes the virus start to inactivate a little bit faster at that humidity. So if you're working in an environment that you can't control and you've got high humidity, you need to put more effort into surfaces and cleaning surfaces. If you are working in an environment with lower humidity, you need to put more effort into cleaning air and air exchange. There's a balance with that, depending on what you're working with. Not the final risk, but the final risk I'm going to talk about before opening it up is the risk of surfaces. So those respiratory droplets need to land somewhere. Whoops. My computer just stopped. Those respiratory droplets need to land somewhere. Every time someone coughs on their hand or adjusts their face mask, where they touch can potentially be infected. Now, you can touch that yourself and never become infected yourself. You don't become infected until you touch that surface and then rub your eyes, rub your nose, put your hand over your mouth, rub your mouth, those type of things. Eat food is one of the ones that brings it in very, very easily. So when you're looking at your own environment, you've got to look at what are these high contact surfaces, touch surfaces that people will have. Where you can eliminate them, you do. For example, if a door can stay open, keep it open. That way you don't have to have 50 or 100 hands opening and closing the door. That way you don't need to have somebody cleaning the door. So you just cut down on your work. So doors that can remain open, you do it. Swing doors, balusters for kids or people to get into an exhibit, prop them open. Every hand that goes on a surface is something that needs to be cleaned and is potentially containing infectious material. So you want to not be cleaning every hour. You want to try to take away the things that people will be touching that you don't really need to clean when they don't touch them. Now, I know that there's probably some very interesting questions, and we'll get to specific ones about things that people do touch as they interact with your exhibits. We are, and I know I'm working with a good budget here, we are where we're working with movie theaters, like movie film sets. We're working with systems that we can put costumes, we can put props inside them. They ozonate them, and then we take them out and we can treat them as completely clean for the next day or for the next person. So those cabinets work very well, but the budget is probably beyond what most people have working in museums. And this is, when we're working on movie sets, we're dealing with big risks of 30, 40, 50 people not wearing masks. So the risk goes up. So I'll just focus back onto the main risks. Face-to-face conversations. We want to avoid them where we can. When we have to have them, you want to have face masks on people. If the conversation is going to persist, or it could potentially lead to a more animated type conversation, you want to make sure that there's a face shield on that particular person. An example is all the court security staff. When people are coming into the court and they're doing the screening, every single one of those has a face shield. So even though they're behind plexiglass, if they set the alarm off for a metal, they have to come in close to them. If somebody is not listening to instructions, they need to come close to them. So think about that and have face shields ready for people that may need to have that interaction. Inside courtrooms, the marshals, they have a face shield available to them just in case they need to get to a person. They're not wearing it all the time. It's just if the situation actually arises. That's your highest risk, the highest chance of transmission, and that is a one-to-one transmission. Your next risk is having lots of people in an indoor environment for an extended period of time. It literally can just be 2 people. You only need 1 susceptible person and 1 infectious person. But the more people you have, the higher the chance is that you're going to have a person who is infected in that space. Take a very, very simple rule, Massachusetts. We've got 2% of all the tests that we do are positive. Now, there's a little bias in that because that's mainly people that are coming that are sick. But let's just use that number as a way to guide your decision making because it's the best number that we have. If you're in Massachusetts and you have a business and 100 people come through your door in that day, 2 of them are going to be infected and not know it, and they're going to be in your business. If you drop that down to 50 people, now we're down to 1. And if you go lower than 50, now the chances below 1% that somebody is going to be in your business that's going to be infected. So even at the stage of 2%, Massachusetts has envious rates of testing to positive ratios right now. When you start looking at some of these other states, so Texas over 15%, Arizona 20%, Florida is creeping up to, I believe, around 10%. You know, at 10%, you put 10 people in a room, one of them is infected. So that's where you need to have masks, because that drops their emissions to try to protect the other 9 people that are in there. But even 1 at 100, if you've got 100 people in that room, that 1 can infect all 100 if they're in that space for an extended period of time, you know, with poor air filtration and air exchange. So our job when we're operating our museums, our businesses, is to make sure that we have the best air that we can do, masks on everybody, to lower those 2 big risks that we have, face-to-face and then the aerosolized breathing in. Our then job is starting to clean surfaces. The more hand sanitizer stations and things like that that you have around in your business, the less chance that people are putting contaminated hands on your products. They're putting hands on them, but they're not contaminated. So the more you invest there, the less you have to invest in cleaning those surfaces. The fewer hand sanitizing stations or hand washing stations that you have, the more you have to invest and the more often you have to clean surfaces. The thing that I recommend everybody to do is walk through your business like your museum as you would be a guest, and look at every single surface that somebody touches regularly. And you'll know those already. And then maybe bring in a group of people, maybe your staff, and have them behave like a tour group or behave like a group of people coming through, and just watch and see what they touch. And so what we do is we create physical layouts, maps of our buildings. And as we're walking around and noticing that people are touching surfaces, we put red or blue tape on those surfaces, and then we put that onto a map, a heat map. And those high touch surfaces are the ones that we focus our cleaning effort on. So understand what people touch, focus your cleaning effort on that. That's your priority in regards to cleaning. All the other stuff, the surfaces that are not interacted with a lot, you should be cleaning, but they don't need to be on a higher turnover of a cleaning schedule. Some surfaces will need to be every hour. Others might be once a day. It just depends on how many people and how they interact with those things. So I'll leave it at there, and I'll turn it back over to Betsy and any questions.
Yeah, I mean, Heather and Meg, I'm assuming you guys are going to sort of look for the questions. So why don't I throw, well, you already answered one question that I was going to throw at you while I was sort of vamping for time, which was the sort of background community positive test rate, because I think that's, it just tells you what your environment is.
Yeah, so let me go back to that one, Betsy.
Yeah.
I think that's important, and that's what I've been doing with businesses, is helping them understand the data. You need to have a good understanding of what's happening around you. At worst, you need to use state data. At best, you work with your local board of health to get the best data that you can. So depending on where you're drawing people from to your museum, depends on what data that you should pull in. But at worst, you should be looking at the state data, looking at, it's called % of positive tests. So if they run 100 tests, how many of those come back positive? We want that to be below 2%. But even at 2%, like I said, that is putting 2 people out of every 100 is infected. And if you expect more than 100 people through your business, you have to assume that 2 of those are going to come in there. The other one to look at is the trend of that number. So is that trend going down? Is it going up? Is it staying flat? So in Massachusetts, it's flat. We know that we're just sitting there on 2%. We've reopened a little bit, which stopped its downward trend. It was really heading down, but with the reopening, now a few more people are getting sick. So we're stuck at that 2%. If you see it start to come up, and that's your first indicator, and even Dr. Burke said last night in an interview, that is the first indicator that we have that things are turning in our communities, is looking at that percent positive rate. I wrote about Arizona and Florida, Texas about 2.5, 3 weeks ago. We could see the turn up. They were sitting at 3 or 4%, and now they're at 15 or 20%. So we could watch that trajectory come up. Everyone was saying, no, it's not a problem. It's not a problem. The numbers came up. The sickness came up. The hospitalizations come up. And in 2 weeks' time, we'll start seeing the deaths come up. So look at that. So look at how many people are testing positive in regards to percent positive, and then consider what is the trend of that data. That is your best friend in regards to understanding what is happening in your environment. As we see that come up, and if we start to see that come up in Massachusetts, we will be worried if that starts heading back up to 3, 4, or 5%. At that stage, you need to start limiting the number of people or increasing the amount of cleaning. We need to up our risk mitigation strategies there. So understand how to get that. The Massachusetts dashboard is exceptional for this. The Rhode Island dashboard's pretty good. Same with New Hampshire and Maine. They're pretty good.
Cool. Thank you. I have seen a lot of chatter of people purchasing UVC units to either do surfaces or manipulatives, I mean loose parts, and then electrostatic foggers. And I think I worry about occupational safety.
Yeah.
So if you could put some context around that.
The UVC is great. It is a fantastic for inactivating the virus. It is incredibly dangerous for humans. So we have outside, we have UVA, UVB, but UVC is filtered by the ozone layer. So we don't get it, and that's why the virus doesn't get inactivated outdoors by sunlight. People are telling you a story if that's what you're hearing. But UVC is wonderful to put inside your air conditioning systems where eyes don't go on it, where it doesn't have contact with your skin. UVC can only decontaminate the surface that it sees. So it will not get into a shadow. It will not get into a nook and cranny. It will not get through the surface of materials. It can only do the surface layer of what you've got. So I use UVC at work, but it's inside an enclosed cabinet. We turn it on, we leave it on for an hour, we walk away, nobody uses it. It can blind you. It's not something that you should be looking at using if you can possibly avoid it. My thought is if UV light can see it, a Lysol wipe can also get at it. And so put on a pair of gloves and wipe it with Lysol. You will get the same effect and a much lower risk to yourself and your personnel. Foggers, so the hydrogen peroxide foggers are very effective. They're not as expensive as what I thought they were. I'm seeing them from 200 up to, they go many tens of thousands, but it looks like a decent model you can get for around $600 or $800. So hydrogen peroxide oxidizes the outside surface of the virus, inactivates it very quickly. It's not overly dangerous at the concentration being used for people to use it. There are safety precautions that you need to take. You wouldn't want to be doing this in an enclosed space without air coming in it. But if you've seen them use them in aircrafts, they actually work fairly well. The good thing about that is it will wrap around surfaces. It will penetrate into surfaces. It will wet materials. And so it gets a little bit more depth into what you're trying to decontaminate. And that is sort of what you're after. We're using those type of things for escape rooms. So they were looking at ozone disinfection for escape rooms. And sorry, my computer's playing up. Ozone disinfection for escape rooms. The problem is the ozone is dangerous for people coming into, and you've got to make sure it completely comes out. You can do that for materials in cabinets that have proper venting, but it's not a great one for an enclosed space. So I do like the foggers if you really need to get into materials and things like that.
Cool, thank you.
Heat is another simple one that if you're looking at materials, 135 degrees Fahrenheit for 30 minutes. It was one of my first sort of simple ways to decontaminate masks where you didn't want to wash them. Put it in the dryer for half an hour and the virus is done. At 165 degrees, it's less than a minute. So if you're looking at sort of creative ways to decontaminate material, dolls, things like that, you could potentially put them into a dryer and put them in on a cycle for 30 minutes or 45 minutes, as long as it doesn't harm what you're using. And then that will do that. Washing is obviously with soap is your best bet, but it's probably not something that's reasonable for most things that you're using.
Perfect, thank you. Meg and Heather, how do we find some other questions from folks? Oh, Danielle?
Yeah, small museum, 1, maybe 2 bathrooms. We figured out the capacity per room to control people, but how do we handle the bathrooms most safely?
Yeah, so what we know with bathrooms at the moment is people that are infectious do release live virus in their feces. When they use a bathroom and they flush the toilet, you get something called a toilet plume. And that's, you've seen the videos of people coughing and the spray that comes out when someone coughs or sneezes. It's the same type of thing with toilets. The plume comes up. They've realized now that the biggest risk is to somebody in the stall next to you that is sitting on that stall when someone's in there. So what they're doing in schools is converting all bathrooms to just single occupancy. 1 person in there at a time, even if there's multiple stalls. So that takes away that highest risk of somebody that's infected that flushes and someone's a few feet away and it travels under or travels over and gets to them. The other thing is putting a seat on it, a lid on it. That drops everything down by about 90%. But most public bathrooms have lost seats because the seats were taken out because there was something extra to clean. It's now habit in my household, before you flush, you put the toilet down, just practicing good behavior, flush, and it's just the way that you work. Okay, so then bathrooms. Bathrooms should have, and this is what I've got my own workplace on, so my own university on. It's been a complaint of mine for 12 years, and they're finally fixing it, which is every bathroom exhaust system at my university does not work. Bathrooms, unlike an office, they'll usually have positive pressure or an intake and an exhaust, like they'll have an exhaust and an intake air vent in the one room, so it's changing over. Bathrooms have to be negative pressure. They draw air out, they draw it from the hallway and draw it out. If you've got a fan in your bathroom, turn it on and leave it on. So, ceiling fan, wall fan, exhaust fan, stick one in the window. If you don't have an exhaust fan, work out a way to get one. And again, that dramatically lowers down the risk of the bathroom for the next person or anybody that comes in, and it makes the place smell better. So if you've got one, have a look at what your system is, determine is it negative pressure or is it zero pressure, and try to adjust that. If you don't have either of those, keep them single occupancy. Make sure that you've got a hand sanitizing station on the outside of the bathroom. What I set up is I set up a paper towel station, a garbage bin, and a hand sanitizing station outside of the bathroom. Paper towel, they use it, they open the door using the paper towel. So there's not a high contact surface. They do their thing inside, they wash their hands, but in order to get out, they need to touch the door. So they either grab another paper towel from inside and open the door to do it, or you just provide a hand sanitizing station on the outside, and that stops what's in the bathroom coming out. So make sure it's prominent as they walk out, that they can see it. And again, then what happens in the bathroom stays in the bathroom, and it doesn't become a bigger issue. Depending on the turnover of people, get an elevated cleaning schedule. I'm not talking about hourly. I'm just talking about if you've been doing it once a day. Let's get up to 2 or 3 times a day. I would put up a sign and have my staff actually sign it as they clean it. And that is a really good way to demonstrate to the people visiting you of the protocols that you're putting in place to keep them safe. Those little things people don't really pay attention to, but they do now. And that would be a good one. If they're really busy because you've dropped them down to single use, then get them on a higher cleaning schedule.
Okay, so we do have one in the chat feature here, a question. Are exhibits that blow air helpful or hazardous in terms of air circulation in buildings?
So
someone will have to explain to me what a Benelli blower is.
I'll explain it. Brenda,
Betsy, do you want to explain that one?
Brenda, this was on my list of questions. So in science museums, we allow people to play with air. So a Bernoulli blower is the blower that goes up and you put a ball on it.
Yeah.
I worked on an exhibit where we had fans blowing and people set up obstacles to get a wall of pinwheels going. So they're basically opportunities for people to play with air. And then there are also exhibits where people get to play with fog, so cold mist. So yeah, what do you think?
Okay, so the first one, all that is going to do, the Benelli blower, all that's going to do is move things around the room faster. It's not, I can't see it increasing the risk. What it will do is dissipate it and spread everything further, but it will be at a lower concentration. So maybe the people that are closer are in lower risk than the ones that are further. Yeah, I don't see that being too much of a problem, as long as there's not a habit for people to put their face over them or do what a dog does when it hangs its head out of a window, or we want to avoid that.
They do because they're kids and because they're 7, yeah.
A sneeze or a cough around one of those would be troubling. So I wouldn't be letting unmasked people play with this. If you've got I know they're saying under 2, but let's be realistic. Most kids under 4 have a very hard time doing it. I really wouldn't be running my business with unmasked people in there anyway. We just know how important it actually is. And if they're masked, I don't see a big problem. An air maze, what does that do?
It's a series of tubes, and you usually have valves, and you can send like a scarf or a ball through it, and so it's basically like a Bernoulli blower, but it's an entire wall.
So that's at the Providence Children's Museum. I've seen those with scarves, and you redirect them and go through.
Exactly.
Other than a lot of high touch surfaces, again, I don't really see that messing with what you're actually doing. We need to focus on air exchange. We need to focus on filtration. What happens inside that space? When we look at restaurants where we've had these large outbreaks, they've had air circulation, but not filtration. So they've had a split system on one wall that blows air from right to left, and it affects people that are downstream of it. The air circulates down underneath or back up over the top and then goes back to that unit and gets blown again. So it keeps it in a cycle without any air exchange at all, or without any air filtration. Maybe the large particulate filter to get dust, but nothing else. If you're working with a system that has filters built into it and is bringing in air from the outside in, it doesn't, I can't see those things adding to the risk any more than what it is.
Cool. I'm going to say this while we're waiting for the next person. Somebody wrote about how to handle non-compliant visitors, and I'm going to, since that's really a legal question, Nima had a webinar on reopening, or I don't know if it was a town hall. I'm going to post that right here. Don't click on the link immediately, or at least have your sound off when you do, because it immediately is Heather talking. It starts playing immediately. But it was helpful because it was with an HR and I think a general lawyer who work in in a public health, in a health center. And so I would urge everybody to have a look at that too for those legal questions.
Yeah, so I'm looking up here, one of the questions, but I will come back to your most important thing is to look after your staff, making sure that the people that are working in your museum are appropriately protected. They are in there for an extended period of time, and they have the most interactions with the most people. A guest that comes in don't interact with other guests. They may walk past them, they may touch the same surfaces, but they're unlikely to get into a conversation with others unless they're friends. So whereas the person that is greeting people when they come in, the person that may be helping with an exhibit, they're going to come in contact with everybody. And we know that the more interactions a person has, the higher the chance is of infection. We also know that the more interactions a person have, the more infections that they can pass on. So your job, when you look at your own facilities, is to make sure that you've got the best and the best equipment that you can afford for the environment that you're in to protect your staff. The longer that they're in that environment, the better the stuff that you need to have, PPE that you need to have. And I'm not saying N95s or KN95s, that may be appropriate for somebody that is at high risk. For the majority of people, a good quality, good fitting mask will do enough to help them. But like I said, if they work in a customer service or it brings them close, little kids without masks, I would have face shields available for that interaction. We are seeing with some of the restaurants that customers are bringing it in. They're infecting wait staff. The wait staff are not knowing that they're sick. They're going back to work for 3 or 4 days. And then the latest one we've got is now 180 cases from a restaurant bar down in Arizona. So it will happen. Make sure that your people are not that vector to move it from one person to the other. Yeah, get them looked up and train them well. Hand hygiene, don't touch their face, wash their hands often, have soap ready, have a protocol that they wash their hands 4 times a day. Have little pump sanitizers ready. Until their hands touch their face, it's not a risk.
So there is one thing that's come up. I know this is more exhibit related, but Massachusetts is required to take cash. Right now, the majority of the museums are reserving tickets online and stuff like that. How do you deal with the physical cash if someone pays with physical cash instead of paying online with a credit card?
Yeah, so the risk is, again, there is no risk until the person that touches cash touches their eyes. I'm not a fan of gloves, but if a person's handling a lot of cash, the thing that gloves will do is nobody loves touching their face with gloves. So you bring them up and you're like, oh, and that is that extra reminder if they need that. So the person that's touching cash could potentially wear gloves. When I wear gloves at work, just so that you know, I don't wear gloves all day. I wear gloves and I sanitize my gloves over and over again. So just like I sanitize my hands, when I'm working on something that I need to keep completely sterile, I have usually 2 pairs of gloves on. I then will be working with it. And then before I touch anything else inside that same sterile environment, I am spraying down, sanitizing my gloved hands, and then moving to that next one. Gloves will transfer things from one to the other very, very easily. So put gloves on. And then just, again, clean hands. That may keep their hands off their face. It may keep them off their eyes if they are wearing gloves. Then cash itself, you could just leave it for 24 to 48 hours. And then the risk is essentially gone. It brings into the whole idea of laundering cash. Again, if you heat it up a little bit.
Don't put it in the microwave.
Yeah, no, not the microwave.
No microwaves.
There's metal in them.
Yeah.
So I am not overly worried about the cash side of things, but if someone's touching a lot of cash, then maybe gloves or good hand hygiene comes into the equation. With libraries, I'm just saying, as books are returned, put them away for 3 days and then come back to them, and you don't have to worry about cleaning them at that stage.
Yeah, that study was just released. I think I know Nima's tweeted it a couple of times that IMLS did produce a 3-day thing on the books and stuff, which is great. So we did touch upon a little bit earlier about cleaning. We do have a lot of historic houses on here where people will not be touching. But I'm wondering, are there any suggestions for reducing the risk of transmission, particularly for those staff members who must clean these spaces by dusting and vacuuming them?
So vacuuming, buy the highest quality, use a bagged filter, like a vacuum that has a vacuum that has a bag in it. The one that I have, the Mealy vacuum that I have, has this great bag in there. It's a HEPA filtered vacuum bag. And I can tell you that, and if you've got one or not, because if you're vacuuming and you can smell yourself vacuuming, the stuff that's bringing up, you don't have a HEPA bag in there. Those can work very well, because the last thing you want to be doing is aerosolizing what has dropped out onto the surface. So bagged vacuums are your friend, and buy the proprietary bag that is those HEPA bags. It's important if you're doing that. What was the other stuff? Cleanness, space, dusting, and vacuuming. So I would try to avoid dusting where I can. I realize that if you don't want to hit a 300-year-old surface with a cleaning fluid, again, the last thing you want to be doing is moving this thing up into the air. I would be trying to find the least harsh cleaner that I possibly can that is compatible with your surface. We know Lysol, we know 1% bleach. We know the hydrogen peroxide. I mean, this is maybe where you get to that UVC if you must, but you need to have the people in a face shield. You need to have, long things on. I wouldn't want to go there if I could possibly avoid it.
Well, I know there's been some webinars through Connecting with Collections that they've actually kind of talked about some of these cleaning elements and stuff like that. So I would suggest Scarlett will probably be finding the link in a second to share in the chat and stuff like that. Yeah. So if you guys do have any additional questions, make sure you put them in the chat or raise your hand to actually talk.
Yeah, and most collections people would never let UV go near anything because it's deadly to collections too.
I would have thought.
Yeah,
it's not good.
But in many cases, we're talking about a historic home where there's a room that people are walking through, but they're not allowed to touch anything.
Okay.
So
the risk.
What's the risk?
Risk is if they're not touching anything. So there's some confusing data that's actually confusing me right now that's coming out about how long things last. They've done these surface stability studies and they've done them in labs. They've shown, at the most it's about 3 days. But a study that came out end of last week said that when that virus is packaged up at the right humidity in a respiratory droplet, the proteins in that respiratory droplet, that it can persist for days, if not weeks. I spoke to the study author about that, about what's the practical, aspect of that. We know that transfer surface transmissions are 1%, maybe 2%. They're not the big drivers of infection. But the last thing you want to do is make sure that your staff get infected. So I guess circle back, if we need to dust, if we need to vacuum, this is where you invest in good PPE. You do get a good fitting respirator on that person. The N95, the KN95, that increases their safety. Just something to keep in mind, someone will bring up goggles. It takes like 5 or 10 times the amount of virus through your eyes to infect you. It takes less in through your nose and much, much less in through your lungs. So that's why we see this big gradient, and that's why we see the room spread that I talk about, the dangerous one, is because those fine little particles, as you breathe them in, get deep down in your lungs with cells with a lot of these ACE2 receptors, and that's where you get in trouble. Eyes don't have as many. You need to put more virus there to become infected. So what we're trying to do is avoid breathing it in.
All right, so we do have a couple links in the chat for the collection care and stuff like that. So we did have an earlier question. I think you kind of touched upon it a little bit about, you know, with the court system, with the masks and what you just mentioned with the face masks and stuff like that, because we do have a lot of art handlers that have to get up close and personal with the pieces and with each other to actually move the pieces around. So I think you did answer that question. I just want to point that one out to the person that actually did answer that. So
when you need to have two people close, invest in your PPE.
mm-hmm.
You don't need to be throwing out your KN95 every time you use it. I get mine sandwich container. So get a sandwich container. You know those little silicone plastic, those packets that come in when you order something that keeps things dry? Put a couple of those in that container. Now with your KN95, when you want to take it off with the ear loop, put it face down into that sandwich container, wrap the ear loops around underneath it and clip it up. That stops it going into a pocket. That stops a hand going on it. The silicone little beads that pull the moisture out, take any moisture that's in it and keep it in a good condition. When you need it again, open it, grab an ear loop, put it around. That's how I preserve my KN95 that I use regularly when I've got somebody on my shoulder when I need to work. You don't have to worry about skin touching skin. You don't need to worry about, you know, those type of things. It's, again, eyes, mouth, nose, breath. If we take the breath away with a good fitting mask, especially the N95s, I'm stopping what's going out and I'm also filtering what's coming in, so I'm doubly safe. We're doing this with the Boston Lyric Opera. We can put a whole bunch of violinists next to each other if they're all masked. We don't need 6 foot spacing. We don't need those things because from an infection control standpoint, they're not there. So think about what you can do. We're doing the same with hair and makeup on actors. The actor can't have a mask on. They can't have a shield on because they need to get makeup on. But the people working on them are donned in PPE, so they're not a threat to that person.
I guess definitely my biggest takeaway is invest in your staff.
Yeah.
I think that's the biggest thing for me is make sure you invest in your staff to make sure that they have the proper
One of the businesses that I worked with, they work outdoors, they're a brewery. I said, this company makes a really good mask that's very comfortable, so you know that your staff are going to wear it and be compliant. And he went out and bought 2 for all of his staff. And that way you knew you had a uniform level of quality mask in your environment. Mm-hmm. That's not the same for proper PPE with face masks and that, but again, go to courts, they're providing that because they don't want people to bring in their own, because then you have variations in the quality that's there. Set a minimum standard and you can provide that for them. And that way you know that you've done the best that you can by your employees.
Good. Erin, I just want to say thank you. I know you had a hard stop at 11 o'clock and stuff like that. So I do want to thank you for coming on and sharing all of your expertise. We do greatly appreciate that. Betsy, I know you probably have some final words.
Well, I was going to read a text that I got. I'm not going to say who sent it to me, but yeah, this just sums it up. He's fantastic, and this is going to be so helpful for people. 5 thumbs up, and then awesome with 1 exclamation point.
So if there's anything that comes up now that people think, can you filter them through, you know, Betsy, Meg, Heather, and send them through, and I will try to get to them later tonight. Okay. So if there's any specific questions or anything that needs clarification, put them there, and then just outstanding questions from the NEMA meeting, and I'll try to get onto those later tonight.
Cool. Thank you very much. Yeah, if other people want to hang around and start documenting them, people are asking about chat, so we can do our administrative stuff.
Yep.
So I live in Westport, Massachusetts. If you are in my easy circle, sort of Providence and around, and you do want to have an extra set of eyes on your business, reach out again through, and I'll see if I can squirrel out some time to come out and look at what you've done and what you've put together, and help if I possibly can.
Cool, thank you. I am seeing some other questions, so we will definitely hit you up on some of those. So
Okay.
thank you so much.
All right, thank you, Aaron.
Have a great day, everybody. Nice
Go
meeting
get
you
some
all.
sleep. This man was up with puppies last night or the night before.
We had,
Birth.
we're fostering a rescue. We've got a rescue dog here that had 11 puppies yesterday, so I haven't slept for nearly 2 days.
11 puppies she gave up after 7. So
Yes.
Erin was taking it from there. Thank you so much.
Thank you,
Bye,
Aaron.
everybody.
Appreciate
Bye.
it. Goodbye. Thanks. Yeah, one of these questions is about the clear face mask so that people can lip read. I've wondered that too, so I will definitely ask that.
I think that one's definitely going to be something that we need to discuss, because I'm thinking of my mom in general. She reads lips. She's hard of hearing, and so her sphere of where she interacts now is incredibly small because she can't.
Right,
read
and that's exactly the case for anybody who is hard of hearing or who loves somebody who's hard of hearing. So
yeah. So definitely, if you guys do have any like follow-up questions, put in the chat. Scarlett did leave our email addresses earlier on, also with Betsy's. We could do any follow-up questions with Aaron if you guys do have them and stuff. So.
And if you're not following his blog, I really highly recommend it. He's just got a really good way of explaining things. And I have shared many of his articles with colleagues who were then able to share it with the powers that be who were not listening. And I also recommend the NEMA webinar with the 2 lawyers. That can be very sobering for people that are pushing you to do things where your gut is saying, I don't know.
Yeah. We also have a new one that was just announced today on frontline staff with visitor services. So I know the whole enforcement of the face mask has come up quite a bit. So that will be something that we'll be talking about. And that's on July 9th.
And I know AAM has, a lot of people have been sharing resources about de-escalation training.
Yep.
Cool. Thank you, everybody.
All right.
you.
Thanks, Betsy, for pursuing this. We appreciate it.
Well, thank you for I gave up on the national guys. So.
We're always here at the regional level for you.
Now I'm going to share it on the national
level. Well, that's good.
Yeah, cool.
Thanks, everybody. And I hope to see you guys at a future webinar or town hall. Thanks.
Thanks.
Bye.
Goodbye. So you guys are saving this chat?
Yeah, it will automatically download to my computer.
Okay.
So we're good. Yeah.
Cool. Thank you. Bye.